So, gastric lavage is the topic of discussion today. So, gastric lavage is a very important question in your university exams, in your forensic medicine exams. So, before we go into that, let us see about the removal of the unabsorbed poisons. So, we have either inhaled, injected, and contact poisons. Three are there. And when it comes to the inhaled poisons, it is you have to move the patient to the fresh air, and we have to provide the artificial respiration, okay, and oxygen that is 6 to 8 liters per minute, and keep the air passages clear. So you can either do postural drainage or suction. When it comes to the injected poisons, we have to apply a tourniquet above the injection site, and you have to loosen for about 1 minute every 10 minutes. Every 10 minutes, you have to loosen for 1 minute to prevent the gangrene. And next thing is you can do a cold immersion of lesser than 10 degrees Celsius that slows the capillary blood flow, and therefore it will limit the absorption. And next you have contact poisons. Contact poisons we have, it is immediate, it is copious flushing with water, saline, or drinkable liquids. Okay, so this is immediate. We have to do copious flushing with water, saline, or drinkable liquids. And exceptions of them are alkali metal, calcium oxide, and phosphorus. For eye, you can use saline, and for dermal decontamination, you need to do triple wash. Triple wash has water, soap, and once again water. And body cavity decontamination, you have to do irrigation of the vagina or the rectum. Next, fourth one is about the ingested poisons, that is gastric decontamination, where we do the gastric lavage. That is the topic of discussion today, and which is nothing but your stomach washing. So it's most effective within 1 hour. 1 hour can be done up to 6 hours, 4 to 6 hours, but 1 hour is the ideal set. And you can use 36 to 40 French or a gastric tube. Okay. And for children, you can use 22 to 28 for children. You can also use Riles tube, but it should have that length. Then sequentially administer and aspirate 5 ml fluid per kg. You have to aspirate until the fluid is clear, odorless. You should do it. And stop if bleeding occurs. Right? Okay. What is the procedure that you do here? The patient is in the Trendelenburg position. The mouth is lower than the larynx, and that prevents your aspiration. Left lateral decubitus, okay, where you have pylorus upwards, prevents the poison passage. The two positions, Trendelenburg and left lateral decubitus. And confirm the stomach entry, so inject air and listen for any bubbling sounds over the stomach. Misplacement in trachea. You have some hissing noise, reflex coughing, bubbling in water. Now, coming to the fluid administration, you are supposed to give 250 ml of water is injected. You have to wait, you have to aspirate for chemical analysis. And leave a small fluid amount in the stomach for neutralization. What are the fluids you use in gastric lavage? First one is the normal saline, right? For except infants, where you need to use normal saline, you can use tap water. Other are 1 is to 5,000 ratio KMnO4. Potassium permanganate and NaHCO3, sodium bicarbonate, that is 5%, tannic acid 4%, 1% is sodium iodide or potassium iodide, and 1 to 3% calcium lactate. And saturated lime water or starch solution can be used. What are the complications? You can have aspiration, 10% chance. Serious 1%. Any esophageal or gastric perforation can happen, and tube misplacement in trachea can also happen. Coming to the contraindications of the gastric lavage. There are eight in number. One is the corrosive poisoning, carbolic acid. There is a risk of perforation, very important. Convulsant poison. We have strychnine that may trigger the convulsions. Then you have comatose patient. There is aspiration risk. Next, we have volatile poisons and hydrocarbons, petroleum distillate, kerosene. They have risk of aspiration, pneumonitis. And esophageal and gastric pathology, like you have varices, any recent surgery, there's a risk of hemorrhage and perforation. Next, we have hypothermia or hemorrhagic diathesis, that is contraindicated. Compromised unprotected airway is contraindicated. And you have some ingested foreign body, example, drug packet, along with the drug. If the patient is taking in that manner, then also it's contraindicated. What are the gastric lavage tubes that you use? First is a Ryle's tube, okay, inserted along the nose to the second marking, that's mid-stop. First marking is at the cardiac end of the stomach. Third marking is the pyloric end. Next, you can also use a Ewald or Bose tube. It's a non-collapsive rubber tube of 1 centimeter diameter and 1.5 meter length. With a suction bulb is present, a hood mouth gag for non-cooperative patients. And what is the position for this? We can do a Trendelenburg position. The feet higher than the head by 15 to 30 degrees. That is this. Coming to the alternative methods. Only if gastric lavage is not possible, you can do this emetics. Next, only if unconscious patient to prevent aspiration. If the patient is comatose, then that is different. If the patient is conscious, you have to do gastric lavage. And if the patient is at risk of aspiration, then you can do this. What are the methods? We have household emetics. We have some large amount of warm water, mustard powder, 15 grams in 200 ml of warm water. It's not very effective. And you can also have common salt, 2 tablespoons in 200 ml of warm water. That also can cause salt poisoning. And other emetics is syrup of ipecac. You can give 30 ml for adults, 15 ml for children. Zinc sulfate, 1 to 2 grams in 200 ml of water. But nowadays it is not being used. We are not using it. And there's ammonium carbonate, 1 to 2 grams in 200 ml of water you can use. And there is also apomorphine, 6 mg subcutaneously, naloxone, 5 to 10 mg intramuscular. And it's not recommended due to any CNS respiration, depression, and aspiration risk. Okay. Mechanical stimulation, like, finger down the throat or tickling the throat is there, but the chances of some trauma in that cases. Then you should not ever use emetics. Same as gastric lavage plus additional contraindication, there is severe heart or the lung disease, advanced pregnancy, CNS depression, as we already said, seizures or really rapid acting CNS poisons like camphor, cyanide, tricyclic antidepressants, proproxifene, and strike. Next, we have dilution therapy, where it is recommended for any corrosive ingestion, acids or alkali. And the method is you have to drink 5 ml per kg body weight of water or clear fluid, where you do the dilution actually. Other methods that we do is the endoscopic surgical removal. Toxic foreign bodies are there, no? They fail to pass to the GIT. That can be done by surgery. A lethal heavy metal injection is there, arsenic, iron, mercury, thallium, gastric Benzos, that is barbiturates lithium, mebromidine, salicylate, sustained release drugs, and you have cocaine packets, that is leaking in the GIT, immediate surgery, immediate surgery, as you have seen in certain movies. So, first we saw the removal of another poison. We have four methods of the poisoning. And in ingested poisoning, we saw about the gastric lavage. What is the procedure? What are the fluids used? What are the complications? What are the contraindications? What type of tube is used? And what are the alternative methods? Emetic dilution and other.